Alvin Fiddler is the Grand Chief of the Nishnawbe Nation that represents Kashechewan. He's going to be part of today's meeting, and he joins me now from Thunder Bay, Ontario. Thank you for taking the time to speak with us, sir, today. Grand Chief Fiddler, I want to start by asking what you are hoping to learn, first of all, from this meeting today.
I think we just want to get more information on what's exactly happening in Kashechewan, and we're looking forward to hearing from the medical team later on this afternoon.
From what you're hearing, do you sense that they're any closer to figuring out exactly what is causing these rashes and skin lesions?
I think right now they're just trying to determine who else needs medical attention, and from what we're hearing, that there may be more children that may be required to be evacuated from the community in the coming days.
Well, what is happening to those who are affected by this mysterious rash right now? You say more may be affected. I gather some had been taken to hospitals or to other communities. What's the latest you're hearing on that?
Well, the initial evacuations that were made over the weekend and on Monday, those children were sent to Timmins, and depending on the number of children that may require further treatment, we may need to look at other centers, including Kingston and possibly Toronto.
We, as you know, we don't know yet the exact cause of this mysterious rash and the lesions. We know the Health Minister, Jane Philpott, says the water in the community is not to blame, but I gather you disagree, that you say that that can't be ruled out as a possible cause. Can you tell me more about that?
Well, I don't think we can rule out anything at this point. I think almost all the community members, from what we've heard through our leadership, they do not trust their water source, even to bathe or do their laundry, never mind drinking it. So I think what we're asking for and what they're saying is that they want an outside independent inspection team to come in to examine their water treatment plant and to test the quality of their water.
Certainly, as a parent, we know that when your child is sick, it's always agonizing. But when your child is sick and you don't know exactly what's causing it, I can't imagine how stressful that must be. What are you hearing from the people of Kashechewan yourself?
Well, that was my first immediate reaction when I saw the pictures coming out from Cash over the weekend, and we made arrangements right away to send a plane up there to get those children out, and knowing that there may be more that may be at risk, that's why we're having these conference calls to ensure that we, that the children that need medical attention are getting it on a timely basis, and we're going to have another call this afternoon to hear from the medical team that's on the ground right now.
Well, what are you hearing from the people there? Is there a sense of frustration, or is there a sense of fear because the source is at present unknown?
Well, frustration for sure. I mean, this has been a long-standing issue for Kashechewan, and the fact that they've raised this issue time and time again, and they're still experiencing the health crisis of their children is definitely frustrating for the parents, and I think we begin to get to the bottom of what's going on and to work with the community to develop some long-term solutions for the future.
When you talk about long-term solutions, I want to ask you about your thoughts on the federal budget released yesterday. As you know, with $8.4 billion earmarked over 5 years for First Nations, how could that money, in your opinion, be used to help the kinds of situations you are describing right now in Kashechewan?
Well, we're certainly welcome the announcements that were made on water yesterday. I think the key for us is to work with the ministry, with Indigenous Affairs, to actually plan how those resources will be rolled out. Our concern has always been that whenever there's a big announcement, that how much of that actually reaches our communities. So I think we want to be able to work with them directly to ensure that those resources actually reach our communities.
And in the immediate time, what are you hoping the government will do to help out with this situation, with this mystery illness? What can they do today and tomorrow to help with things there?
I think one of the immediate things that we're seeking is for an outside independent team to go in there to assess their water treatment plant to test the quality of their water to assure the community that if it is safe, that it is safe for them to drink, and also to continue that house-to-house visit to ensure that other children that may be at risk are getting the attention that they need, and if they need to be evacuated, that they're evacuated, but at the same time working towards longer-term solutions with the community.